Same side as her, so we're not like.
Okay. All right, so we start out with the arch of the aorta. The only branches that we have off the arch of the aorta are the coronary arteries. So we have right coronary artery and left, and that's on the heart as far as anything else. Then we have the ascending aorta, and right coronary artery and left coronary artery. The next segment of the aorta that we get to then is the arch of the aorta, and I'm going to turn it around posteriorly. So that's going to curve over and down the back of the heart. We draw it to the left, but it's really down the back of the heart. And we have three branches that come off of the arch of the aorta. The first branch is the brachiocephalic trunk, which curves over to the right, and it gives off two branches, which are the right common carotid and right subclavian. There is no brachiocephalic trunk for the arterial system on the left side, so the left common carotid comes directly off of the arch of the aorta, as does the left subclavian. The two common carotids then are parallel as far as their branches are concerned and form the internal carotid and external carotid. That's as far as I would go on the wire model, as far as what I would ask you to know. Off of the subclavian, we have the two vertebrals, and those join to form the basilar, and then again we'll look inside the skull for the rest of those components. So turning around to look at the upper extremity, we have the subclavian, where all of these branches are coming off would be axillary, and then brachial. So I would tag it just above where brachial ends by forming the ulnar artery and radial artery. Get an anatomical position. Ulnar is going to be medial, and radial is going to be lateral. This particular model only shows two arches. So the more anterior is going to be the palmar, and the superficial palmar, and the posterior is going to be the deep palmar. Looking at the descending aorta, it's divided into two parts. So above the diaphragm, we have the thoracic aorta. And for lab, all you need to know are these intercostal to posterior intercostal arteries. In lecture, however, remember I wanted you to know the anterior branches, which were the brachial arteries. Bronchial arteries. And those are significant because they are the only arteries we talked about that carry oxygen to the lungs. The pulmonary arteries are carrying deoxygenated blood. But the bronchial arteries coming off of the thoracic aorta are carrying oxygenated. Then we pass below the diaphragm, and since we're still on this posterior view, we continue that paired vessels, which are the lumbar arteries. Coming back around to the front, what you can't see on this model would be the inferior pharynx, going to the diaphragm. And then way up high is the celiac trunk. Probably the only vessel of that I would ask on the wire model might be the splenic artery, going over to the left, because the others are small and tight and up high. But the splenic artery is a branch of the celiac trunk, and we also have left gastric and hepatic. The next branch, which is missing on this particular model, would be the superior mesenteric artery, and that would be coming off to the right. We have the renal arteries, the gonadal arteries, and then on this model here you can see the inferior mesenteric. But most of those I would tag on a chart or on the large stomach model. Finally, the abdominal aorta ends by forming the left and right common iliacs and gives off a median sacral branch. Common iliacs form internal iliac and external iliac. The only named branch of the internal iliac that I want you to know is the obturator artery, and that's best seen on the lower extremity, but recognize that internal iliac arteries provide the oxygenated blood supply for all of our pelvic organs. So the middle rectum, the inferior rectum, the perineal structures, the uterus, the vagina, seminal vesicle, prostate, glands, all of that. Once we're past the inguinal ligament, we're in the femoral artery, or femoral artery, which passes through adductor magnus, and when we see it posterior to the knee is the popliteal, or popliteal. As soon as the anterior and posterior branches are seen, that's the end of popliteal. So I would probably tag it up here to make sure that you're not confusing it with the femoral. Okay? This branch is the profundus femoris, which is the deep femoral artery, and you don't have to worry about that one. Right, anterior tibial passes between the tibia and the fibula to lie deep to extensor hallucis, and then comes onto the top of the foot to form the dorsalis pedis. Posterior tibial goes down the deep portion of the posterior compartment of the leg with the tibial nerve and goes to the big toe on the bottom of the foot as the medial plantar artery and the little toe as the lateral plantar. A lateral branch from the posterior tibial is the fibular artery, okay, and that supplies the ankle side, but doesn't go onto the foot or onto the bottom of the foot. All right, returning now back to the heart, since we're down the lower limbs, let's return back from the lower limbs. So we have the anterior tibial artery, the anterior tibial vein coming up from the dorsalis pedis vein, coming up from the anterior compartment of the leg. The posterior tibial vein coming up from the back of the leg and receiving the lateral vein, which is the fibular vein. These two veins come together to form the popliteal vein, and that receives the small or lesser saphenous. So then this area from here to here would be the popliteal, beginning where the anterior and posterior tibial join, receiving the small saphenous and ending shortly above that. Then we have femoral vein, and the femoral vein receives the long great saphenous. Femoral vein becomes external iliac, and external iliac and internal iliac join together to form the common iliacs, and we have the inferior vena cava, which also receives lumbar veins. You can't see it on this model, but it's going to receive the right gonadal, the two renal veins, and hepatic veins. The inferior mesenteric vein here, let's see if I can, is going to run into splenic vein, which joins with superior mesenteric to form portal vein. And that's all we can see up under this region. From the abdominal region, we have this vein also receiving lumbar veins. It becomes the azygos. And the azygos, here's the azygos on the right side, goes into the superior vena cava, receiving posterior intercostals. And the hemiazygos on the left side crosses over behind the heart to empty into the azygos. And then, of course, that also empties into superior vena cava. From the upper extremity, well, from the back, we're here, we have the deep veins, which are radial vein, joining with ulnar vein to form brachial. Brachial ends to become axillary. Axillary ends to become subclavian. When we look at the superficial veins, our most lateral is the cephalic vein. It's going to drain into axillary just before axillary becomes subclavian. Medially, we have the basilic, which empties into axillary just after brachial became axillary. So both cephalic and basilic are going to empty into the axillary. Here we have median antebrachial, and it's going to go either into the median basilic or the median cephalic or median basilic, because this is a Y pattern. But if we didn't have the Y pattern, we kind of move this over like that, then we would have the median cubital. So the H pattern, the median cubital, is what you need to identify. All right, from the top, from the head and neck, we have the internal jugular, all right, which is receiving the sinuses, but I won't tag any of these. And it joins with the subclavian to form the brachiocephalic. This is the external jugular, which drains into the subclavian. The vertebral also drains into subclavian. The subclavian and internal jugular form brachiocephalic, and that's true on both the right and the left sides. We don't have any asymmetry here. The superior vena cava then is going to receive three vessels: the two brachiocephalic veins and the azygos. Right?